A widow told her doctor, "I just feel tired." He gave her pills. What he missed was that her unspoken grief was eroding her brain health and doubling her heart risk. This isn't rare. It's happening all around us, and maybe even in your family right now. But there is a way to stop it, to recover and to heal, not just emotionally, but physically. Today, you'll learn why grief recovery is more than healing the soul. It's life-saving science for the heart and brain. You know, that story still gives me chills. A woman sitting across from her doctor saying just 4 simple words, "I feel tired." And instead of asking what was happening in her life, instead of digging deeper, she was handed a prescription. I can't help but wonder how many of us, our parents, our friends, even ourselves, have walked out of a clinic with pills in our hands, but no one ever asked about the invisible weight we're carrying.
Susan, you're right. And the tragic part is that invisible weight is often grief. It's not just sadness, it's a physiological storm. Research from the American Heart Association shows that people who lose a spouse are nearly twice as likely to suffer a heart attack or stroke in the first 30 days after the loss. Their stress hormones surge, their blood pressure spikes, their immune system falters. That's not just emotion, it's biology.
So when we say grief breaks your heart, it's not a metaphor?
Not at all. There's even a medical term for it, Takotsubo cardiomyopathy, often called broken heart syndrome. The left ventricle of the heart literally changes shape under emotional shock, weakening the pump that keeps you alive. And here's what most people don't know. Unresolved grief doesn't just cause this in the immediate days or weeks after loss. It lingers. Studies out of the University of Pittsburgh in 2022 found that seniors with chronic, unresolved grief showed higher levels of inflammatory markers like C-reactive protein, which are strongly linked to both dementia and heart disease.
So grief doesn't just fade with time, like people often say.
Exactly. That's one of the biggest myths. People say, time heals all wounds. But the data shows the opposite. If grief isn't expressed, if it isn't processed, the brain and the body start adapting to it as if it's the new normal. And that's dangerous. In fact, a 2021 study in JAMA Psychiatry found that prolonged grief disorder actually alters brain connectivity, especially in regions tied to memory and emotional regulation. That means grief isn't just an emotional weight. It literally rewires the brain.
That's terrifying, and yet it makes sense. I've met seniors who, years after losing someone, still speak with this quiet exhaustion, like life itself has been dulled.
Yes, and here's the heartbreaking part. Those same changes raise the risk of Alzheimer's and vascular dementia, which means the very memories of the person you lost, the ones you want to hold on to, become more vulnerable to fading because grief wasn't addressed. But, Susan, before we go too dark here, there's an important twist. The same research shows that when people engage in structured grief recovery, actually working through loss, not just waiting, it reduces inflammation, improves heart rate variability, and even restores healthier brain patterns. And the sooner it begins, the stronger the protection.
So, grief recovery isn't just emotional healing, it's prevention.
Exactly. Prevention, resilience, and in many cases, restoration.
You know, I have to admit something here, David. When I hear the words grief recovery method, part of me thinks, oh no, another self-help fad, another thing people sell to the vulnerable.
I hear that reaction all the time, and I don't blame you. But this isn't about a quick fix or a trendy program. This is about evidence-based approaches that combine psychology, neurology, and cardiology. For example, a 2019 randomized trial at Columbia University showed that seniors who participated in structured grief interventions not only reported less depression, but also had significant reductions in blood pressure and cortisol. That's measurable heart protection.
So the body listens when the heart speaks?
Always. And the brain, too. Here's something fascinating. MRI studies from the University of California found that people actively working through grief showed increased activity in the prefrontal cortex, the part of the brain that regulates emotions and decision-making. That means recovery isn't just about feeling better, it's about literally rewiring the brain toward resilience.
Wow. And yet, so many people, especially seniors, don't even know this is possible.
That's the tragedy. Seniors are often told, well, you'll just have to live with it. But unresolved grief isn't something you live with, it's something that slowly wears you down. In fact, the CDC recently noted that grief-related depression and loneliness are now recognized as risk factors for premature death, on the same level as smoking 15 cigarettes a day.
15 cigarettes a day? That's shocking.
It is, and that's why conversations like this matter.
David, I'm thinking of a friend right now. She lost her husband 2 years ago. Everyone told her, you'll adjust, you'll get through it. And she does keep going. She shops, she cooks, she sees her grandkids. But every time we sit down for tea, she'll just say, I just don't feel like myself anymore. It's not sadness in the way we usually think of it. It's like a quiet emptiness that doesn't leave.
That's exactly it. Grief often disguises itself as fatigue, brain fog, even physical pain. People think they're just getting older when in reality, unresolved grief is weighing down their nervous system. And here's the kicker, Susan. If your friend's doctor doesn't ask about her loss, if they only treat the symptoms like fatigue or high blood pressure, they miss the root cause.
So it's not just about better medicine. It's about better listening.
You've nailed it. Listening is medicine. In fact, the grief recovery method at its core is about creating safe, structured conversations where loss can be expressed fully without judgment. That expression literally lowers stress hormones, and over time, it can protect both the heart and the brain.
You know, I think back to when I lost my father. I kept telling myself I need to be strong for my family. I never cried in front of anyone. And yet, inside, I felt this constant weight in my chest. I didn't realize at the time that being strong might actually have been hurting me.
Susan, thank you for sharing that. And yes, that's another myth, that strength means silence. In reality, silence is what damages the body. A 2020 study in the journal Psychoneuroendocrinology found that people who suppressed grief showed a 47% higher level of interleukin-6, a key inflammatory marker tied to both heart disease and Alzheimer's. So, by staying silent, by holding it in, you're actually raising your physical risk.
So holding it together might literally be breaking us down.
Exactly. But, and this is important, just as silence can harm, expression can heal. And the changes aren't just emotional, they're measurable. Blood pressure lowers, sleep improves, memory stabilizes, and there's a simple at-home test we'll talk about later that can actually show if your body is carrying unresolved grief right now.
A test at home? Now that I want to hear. So, David, before the break, you left us on a bit of a cliffhanger. You said there's actually a simple at-home test that can reveal whether our bodies are carrying unresolved grief. That sounds almost unbelievable. What is it?
It's surprisingly simple, Susan. It's called the Heart Rate Variability Test, or HRV. You can do it with most modern blood pressure cuffs or even smartwatches. Essentially, it measures the tiny variations in time between heartbeats. A healthy, resilient nervous system shows good variability, but when someone is under chronic stress, like unresolved grief, the variability shrinks.
So your heart literally becomes less flexible, less responsive to life.
Exactly. Think of it like this. A healthy heart is like a jazz musician, able to improvise, adjust, respond to different rhythms. A grieving, overloaded heart starts sounding like a broken metronome, rigid, predictable, unable to adapt. And research from Harvard Medical School in 2020 showed that seniors with low HRV were significantly more likely to develop not just heart disease, but also cognitive decline.
That gives me goosebumps because when I think about my own losses, yes, I pushed through, but I remember feeling like I wasn't really adapting anymore. Everything felt heavy, fixed, like I couldn't bounce back.
That's exactly what HRV is capturing. It's the body's way of saying, you're stuck. And here's the hopeful part. When people go through grief recovery, HRV improves. Their heart literally relearns how to be flexible.
That's incredible. But how does that actually happen? I mean, what does grief recovery look like in practice?
Good question. The grief recovery method is about two things: expression and completion. Most people stop at expression. They cry, they share memories, but they never reach completion, which means finding a way to resolve the unfinished emotional business that grief leaves behind.
Unfinished business, like regrets or things unsaid?
Exactly. Regrets, guilt, anger, even unspoken love. Our brains are wired to seek resolution, and when we don't get it, the stress loop stays open. And here's the science. A 2021 study in Frontiers in Psychiatry showed that when people worked through grief completion exercises, their amygdala, the brain's alarm center, calmed significantly. That shift allowed the prefrontal cortex to re-engage, bringing clearer thinking, better memory, and more stable emotions.
So the brain actually stops living in emergency mode.
Exactly. And when the brain stops firing emergency signals, the heart calms, blood pressure drops, and inflammation lowers. It's all connected.
Can you give us an example? Something practical, something a listener could picture themselves doing.
Of course. One of the simplest tools is writing what we call a completion letter. You write, without editing, to the person you lost. Not just, I miss you, but everything left unsaid. I'm sorry I never told you how much that moment meant to me. Or, I forgive you for the times you hurt me. Or even, I wish I had said this before you were gone.
Oh, David, I can feel my chest tighten just hearing you say that.
That's the body's recognition, Susan. Those words live in you until you give them a place to go. And here's what's remarkable. Studies show that seniors who engage in structured grief writing exercises not only feel lighter emotionally, but within weeks their sleep quality improves and their risk of arrhythmias, the dangerous irregular heartbeats, declines.
So, writing, something so simple, can shift the heart's rhythm?
Yes, because it's not just writing, it's releasing. The act signals to the nervous system the loop is closing. And once it does, the body can redirect energy from surviving back to healing.
It makes me think of my mother. After my father passed, she would sit by the window every evening with his old sweater in her lap. She never spoke about what she was feeling. She just sat there, quiet. And I realize now she wasn't completing anything. She was frozen.
Yes, that's the danger, frozen grief. It's like emotional scar tissue. And the longer it stays, the more it hardens into physical risk. But here's something fascinating. A 2022 longitudinal study from the Mayo Clinic found that seniors who went through structured grief recovery sessions had a 35% lower incidence of stroke over the next 5 years. That's as powerful as some medications.
That's extraordinary, and yet no one talks about it. Doctors don't talk about it.
That's the blind spot. Medicine is excellent at treating symptoms, blood pressure, cholesterol, insomnia, but it struggles with root causes like grief because they don't fit neatly into a prescription. And yet grief recovery is medicine. It's just delivered through words, presence, and connection.
Words as medicine. I like that.
And the best part? It's medicine without side effects.
That's perfect.
I think a lot of seniors listening right now might be thinking, but what if I don't have someone to talk to? What if I'm alone with my grief?
That's such an important point, Susan. Grief recovery doesn't always require another person. Guided journals, community groups, even telehealth counseling can help. In fact, the University of Toronto ran a study during the pandemic showing that seniors who joined virtually grief support groups had significant improvements in memory tests and a 40% reduction in self-reported chest pain linked to stress.
So even across a screen, the body responds.
Yes, because connection, even virtual, is still connection. What matters is breaking silence.
David, I have to be honest. I'm sitting here thinking about all the times I've gone to the doctor and felt like they were rushing through the appointment, like they didn't want to open the grief box. Maybe because they didn't know what to do with it.
You've touched on something crucial, Susan. The doctor doesn't listen dilemma is real. Many physicians are trained to fix, not to sit with. But here's what patients can do. Use what I call the 3-sentence script.
The 3-sentence script?
Yes. It goes like this. I'm not just dealing with physical symptoms. I've been carrying grief, and I think it's affecting my health. I'd like us to talk about it. Simple, clear, and direct. It opens the door and signals to the doctor, this matters.
That feels doable, not confrontational, but honest.
Exactly, and research backs it up. A 2019 study in patient education and counseling showed that when patients used clear, direct scripts like this, doctors spent 27% more time on psychosocial issues, and patients had better outcomes months later.
That gives me hope, because sometimes we don't need a miracle, we just need someone to listen.
Exactly. And when listening happens, healing follows.
David, you've explained the science and the steps so beautifully, but I know listeners are asking the same thing I am. How do you know when grief is unresolved? How do you tell the difference between normal sadness and the kind that's actually harming your heart and brain?
That's such a critical question. And the truth is, most people don't know. They think what they're feeling is just life now. But there are signs. And in a moment, I'll share the 3 hidden signals that grief is not just emotional, but physical, and why ignoring them can be as risky as ignoring chest pain.
Okay, now I need to hear this.
So, Susan, here are the 3 hidden signals. The first is persistent fatigue that doesn't improve with rest. People think, I'm just old, I'm slowing down. But research from the University of Michigan in 2021 showed that unresolved grief doubled the likelihood of chronic fatigue in seniors, independent of age.
That's my friend to a T. She naps, she rests, but she still says she feels drained.
Exactly. The second signal is cognitive fog. Trouble concentrating, forgetting small things. A Yale study found that grieving seniors performed 30% worse on memory tests, even when they didn't meet criteria for dementia. The brain is literally overtaxed trying to process loss in the background.
So it's not just aging, it might be grief showing up as confusion.
Right. And the third signal?
physical pain with no clear medical cause, backaches, headaches, chest tightness. A Journal of Behavioral Medicine study in 2020 linked unresolved grief to increased musculoskeletal pain in seniors. It's the body storing sorrow.
That breaks my heart. People carrying pain their doctor can't explain, when really it's grief.
Yes, and the danger is that these signs are so easy to dismiss. That's why awareness is the first step.
Okay, David, you've painted a vivid and a little scary picture, but let's give our listeners hope. If someone recognizes themselves in those signals, what's the first thing they can do today?
The first step is acknowledgement. Simply saying, this isn't just sadness, this is grief, and it's affecting my health. That shift reframes the experience from something to hide into something to heal.
And then what?
Then, expression, whether through a completion letter, talking with a trusted friend, or joining a support group. And here's where the science is stunning. A 2022 study in aging and mental health showed that seniors who engaged in structured grief expression had a 60% improvement in heart rate variability within 6 weeks. That's the body healing in real time.
6 weeks. That's faster than most medications.
Exactly. And from there, it's about building protective routines, movement, journaling, even mindful breathing. A Stanford trial in 2021 showed that 10 minutes of guided breathing a day reduced inflammatory markers in grieving seniors by 25%. Simple daily practices strengthened the heart-brain connection.
You know, I can imagine someone listening right now, maybe holding back tears, thinking, it's too late for me, I've carried this grief for too long. What would you say to them?
I'd say it is never too late. The brain has plasticity. The heart has resilience even into the 80s and 90s. A Mayo Clinic review in 2020 found that seniors who started grief interventions decades after their loss still saw improvements in memory and cardiovascular health. Grief doesn't expire, but neither does healing.
That feels like a balm.
And Susan, here's the most powerful part. Grief recovery doesn't erase the memory of a loved one, it strengthens it. Because once the fog of unresolved sorrow lifts, the brain actually preserves memories better. Imagine being able to think of your spouse, your child, your friend, and smile, not collapse.
That's the kind of memory we all want to hold on to.
Exactly. And the research backs it. A 2021 study in Neuroimage found that seniors who completed grief therapy showed increased hippocampal activity. That's the brain's memory hub. Recovery isn't forgetting, it's remembering more clearly.
Oh, I have to thank you, because you've taken something we all feel but don't talk about, and you've shown us it's not weakness, it's biology, and it can be healed.
That's the mission. To remind people, grief is not a sentence, it's a process.
Friends, if you're listening right now and you've been carrying grief, whether it's fresh or decades old, know this. Your heart and your brain deserve recovery. You're not broken, and you don't have to stay silent. Start with acknowledgement. Write the words you've been holding in. Share your story with someone who will listen. And if your doctor doesn't ask, use the 3-sentence script that Dr. Harper shared. I'm not just dealing with physical symptoms. I've been carrying grief, and I think it's affecting my health. I'd like us to talk about it. And if you take nothing else from today, take this. Grief recovery isn't just emotional. It's protection, it's memory, it's years added to your life.
Exactly, Susan. And it starts with one small step.
David, thank you for this powerful conversation. And to our listeners, thank you for letting us into your hearts today. Next week, we'll be talking about something equally important, the hidden signs of bone loss every senior needs to know before it's too late. So stay with us, take care of your heart and your mind, and remember, you're never too old and it's never too late to heal.